So let's see the video. It's the demonstrator that we did.
eHealth Pass mobile app. With eHealth Pass, Yannis can securely access, manage, and share his health data whenever he needs to. Yannis, through the xSHARE button, requests to download and import his patient summary from the NCP. While NCP is currently generating the patient summary in CDA format, there is an extension that now allows the transformation of the CDA to FHIR IPS, which is then imported in eHealth Pass. Yannis is having a teleconsultation with his personal doctor, Dr. Dimitris, and informs him about a new drug allergy during his current medication. Dr. Dimitris is updating Yannis' patient summary in the national infrastructure, and then Yannis is notified to update his personal health record in eHealth Pass.
I am now entering the allergy ISO into your patient summary, and this info will be available to any healthcare professional using this system. That way, you won't be given the same medicine again to put yourself at risk.
Yannis is traveling to Moldova, a country outside of My Health at EU Network, and visits a local health professional to address a health issue that just happened. By utilizing the European Electronic Health Record Exchange format, Yannis has the ability to share his patient summary through eHealth Pass either in PDF format or in EEH or XF to be imported by Dr. George's system.
I had the opportunity through the use of a digital health application, such as eHealth Pass, to access the summary of a patient's medical record from abroad in a non-EU country, thanks to the use of the European Health Record Exchange format. The implementation of this format seems to ensure reliable cross-border access for health professionals in a structured form of medical information, while for the patients, the exchange of their health data safely and on various platforms.
Visualization of IPS in EEH or XF on the left and in PDF on the right.
So to be honest with you, this is Yannis.
Hello everyone.
Yannis is from Idika, the Greek NCP, and now questions or something that you would like us to explain more. I don't know if the demonstrator was enough based on what you have heard before from Fabio and Nenad. No questions? Please.
So if I understood your architecture, you access the current CDA-based patient summary that is accessible by any other country that has an NCP connected both to the Greek NCP and who retrieve that summary. You act in you have a national hub that is getting it just like any other country would, and you transform this and make it available in an IPS / set of resources back to a application. So in a sense, you've built a national yellow button portal.
In a sense, yes.
Correct?
In a sense, yes, but to be precise, when I request to import the patient summary, it makes the CDA to FHIR, and then I get it.
Correct.
Yeah.
Yeah, no, I understand.
Okay.
Yeah. Okay.
Robert, please.
So you've been implementing the yellow button as a user interface in the Europass Act or the whatever it is called, the app. But there's part of the infrastructure to deliver on that yellow button is in the IDICA NCP infrastructure.
Yes, and there is also the portal, which we are now trying to see how we can give access to the patient there also, because the cross-border portal has some kind different regulations, and I think Yanis can give if you need more information about it. But right now, patient cannot access that as it is right now.
Yes.
Actually, it would be open to other apps to also push the same button and get the same FHIR IPS.
Eventually, any yellow button app could do it.
Good to know.
On that point, if I understand correctly, this app essentially did implement this box which did say data management in the architecture. Is this right?
The app
On
is
the
implemented-
upper left.
The app is implemented in the bottom, and there is infrastructure in the back. Mobile
Right,
application
yeah.
is not the whole.
Absolutely. So the app only had the part which was on the upper left part of that architecture. And I think
The app is using the
Can you
API.
put the slides back?
which API?
Download.
What Nenad showed you was the server side, not the app side. The app side is,
The website is above, it's not on the picture.
yeah.
The app is using patient data, download, share APIs.
So is the idea to have a standardized interface to the data management box then? So that any app
That's what EHRF a la xSHARE yellow button is assumed to do.
Yeah, I'm wondering at the moment where this is.
Yeah, good question.
So
Where's the app?
where's the app and where's the standardized interface? I saw that you are using inside the infrastructure, you are using IT and
The
IT,
ceiling.
but how can any app get access?
This is what I told before, that the box, the app, the deliverable is not software component only,
Yeah,
but also the specification.
right.
So anybody else can implement the box completely different inside that, as long as it responds and reacts in the specified way.
So Nenad, it would have been nice if you had a couple centimeters on top of your drawing here and put a black line
Consumers.
with a box that says patient mobile app.
Okay.
And have the patient mobile app enter from the top into the security layer and into the data management layer.
Exactly.
That would have,
Very more understandable.
Yeah.
Okay, thank you.
One more question about the NCP Vika here in Greece. First, what was the software that the doctor used in order to report the allergy? How was it used? And in general, we have 130 hospitals in Greece. Are all of the hospitals like report data to Vika or 20%? What's the percentage? And the same about like private EMRs.
Yes, thank you for your question. The Greek doctor currently has a user interface to manage the records of the patients. Currently, hospitals are not interconnected, mainly in production environment, right? Only the prescription and some sections in the e-health record system that are available to the doctor to provide information. But we are almost there to have a new e-health record system in Greece that every public or private facility will provide every information for the Greek patient. And it is to be completed in 1 year from now. EIFI. The current name is AIFI, the new one is EIFI. Right. So the important thing is that soon we will have a great collection of information, and everything will be available for HDS as well, for secondary use, apart from this. Yeah.
And the communication of this would be with like 5.
Sorry, I don't hear.
Communication between the systems would be with 5. How hospitals will communicate with 8.
With AIFI, this is another thing. This is another thing. Yeah. I think it will be using CDAs, but I'm not fully aware of it right now. Yeah. Thank you. Any other questions?
Nothing. So I guess we go back to Maria and Tenant.
Thank you.
Thank you.